Welcome to Skin Side Out, where we uncover the science, trends, and truths behind skin health. Your trusted guide to the world of dermatology. This podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional.
Welcome to Skin Side Out, where science meets beauty. I'm your host, Dr. Zane, with PA Heather and esthetician Courtney. So today we're doing a deep dive into dermal fillers, specifically hyaluronic acid-based fillers.
So we'll talk today about different types of filler. We'll talk about how they work because they can be different from one another. We'll talk about areas to treat and good candidates and what that looks like.
And then we'll also end on adverse reactions and potential complications.
So what is a hyaluronic acid filler?
All right, so let's first go and do a deep dive on what hyaluronic acid is. Hyaluronic acid is actually a sugar molecule, a glycosaminoglycan. And these are complex sugar molecules that kind of give our skin its buoyancy. So it's found in our skin, it's found in our joints, in synovial fluid. And this will allow us to, have, buoyancy, hydration, and has a lot of structural integrity for our skin.
Yeah, and I think a lot of people have heard of topical hyaluronic acid. You see that in different products. So this is, different in the sense that it is being injected to create that nice plump look.
Yeah, and it's a gel when we're injecting it. So they are cross-linked. These molecules are cross-linked together in such a way that it's more of a firm product. With differing, amounts of, viscosity that we're injecting into the skin to achieve the desired result.
Yeah, so there are different options, different brands. Courtney, do you want to give a rundown of different brands?
Yeah, so just like different neuromodulators, there are different companies that have their own fillers. So some common names that I'm sure people have heard of are Juvederm, Restylane, Radiesse. There are the RHAs. So Versa is another one. Even within some of these lines, for example, the Restylane, there are different types of that filler. So for example, you have Restylane Define, you have Restylane Kiss for the lips, you have Restylane L, which just has some lidocaine in it. So depending on what area you're treating, you'll be using a certain filler for that area.
Yeah, and they all have different technologies. So it allows for those different properties that we're looking for, especially for areas where you want more dynamic expression or for areas where you want more structure. The cross links and the technology are really what set them apart.
So let's talk more about how they work. So there's this term called rheology, which is used to describe different types of fillers. So that can include G prime, you might have heard of. That is a rating that we give different fillers based on their fluidity and their flexibility. There's also, like Dr. Zane mentioned, the viscosity, so how thick it is. The resistance to flow is what viscosity is. Also, the concentration of hyaluronic acid in it, the cohesivity, so how will it hold together versus kind of mold with your body and tissues. So there are definitely different ratings and different numbers for different types of filler based on, are you using the filler in your cheek or for a defined jawline, or are you using it where you want something more smooth like your lips or your nasolabial folds? So there are definitely a lot of different characteristics for fillers.
Absolutely. And then you can use those different products in different areas and different depths. So that's why it's really important to know what you are treating, what you're trying to achieve, and then match the product as well as the injection type and technique to achieve that desired result. So for instance, if you're looking at a person's face, the temples, the cheekbones, and the jaw tend to be areas where there's more bony prominence or more of a reservoir to fill. So we use fillers that are structurally more viscous, have higher G prime, and that we inject on the bone. So we're injecting literally on the bone, the periosteum, that's what we call it. And that allows us to have really good structural integrity. Where we have a little bit more dynamic movement in the cheeks, on the nasolabial folds, we want more flexible fillers that are a little bit more fluid, that kind of move with our muscles. It doesn't look rubbery. And we inject it in a slightly different depth. We don't inject down to the bone in those areas. We generally kind of in the mid dermis to the subcutaneous tissue. And then, there are areas that you want to inject a little bit more superficially. So like say, for instance, the lips. You want those hydrated lips, a little bit of structure. You're not going too deep in that, especially for like those barcode or smoker's lines. I really am very superficial, almost to the point where like it's just nearly coming out, extruding from those pores that we're actually injecting because they're so superficial. And then in the tear troughs, like we're injecting on the bone so that, we get the best possible result. You don't get that abnormal swelling and lumps. And then also avoiding that Tyndall effect too. So using the right filler with the right properties so you don't get that bluish tinge when you inject too superficially with some of these fillers.
Yeah, I know you see that more, especially around the eye area, which I think that area is such a delicate area. You really want to make sure you're using the right filler and seeing the right injector for things like that. I think also, I've said this before, but I feel like with filler, it really is about having someone who does, number one, have a great technique, but number two, has that eye for it. It really is an art. And I feel like you have to have both that artist's mindset to know symmetry and how things will look, as well as having the obviously good technique too.
But also looking at the physics too. So we're looking at vectors and how tissue moves. And how we're using these products to volumize and lift structures. So that's also part of it. There's physics involved.
Yeah.
Who would ever thought we would need physics again?
Yeah. I was actually listening to another podcast recently that was talking about this plastic surgeon that got into his field because he felt so creative when he was a kid, and he loved, working with 3D materials and just loved that kind of vector standpoint on shapes. And I think that's why he enjoys his job so much.
So different fillers, depending on what filler, can last different amounts of duration, as well as the areas being treated too. Typically, around the mouth, because we do move that area more, will have a shorter duration than, let's say, somewhere like the temples, where we are using that more viscous filler that's going to hold up longer. Some of the, filler types, like, for example, Radiesse, it typically is used more for that jawline and the temples. It has that higher viscosity. And we tend to see that one lasting a lot longer than some of our other fillers.
Yeah, I mean, Radiesse is not an hyaluronic acid-based filler. It's calcium hydroxylapatite, but it is a great product with high G prime for that structure. And I think it's a great product.
On average, what would you say you feel like your average filler is lasting for your patients?
Really depends on the product.
Yeah.
It really is product dependent. So like my Bellateros and, the Volbellas and, even the Restylane Ls, they don't last as long.
Yeah.
Whereas my Volumas, Restylane Lift, those tend to last a while. So, and it also depends on the patient and what they're doing with their skin, right?
Agreed.
So a lot of our patients are really invested in their skin, their appearance, and they are not only doing fillers, they're doing tox, so neurotoxins such as Botox. They're also doing good skincare, and that goes a long way with collagen induction and structural integrity of your skin. They're doing lasers, resurfacing, microneedling. So it really varies too, because we're seeing patients who are doing multimodal treatments.
Yeah, that's true.
Yeah, so let's dive in a little bit more to areas to treat and who's a good candidate.
Yeah, so I think one area that tends to be neglected is the temple region.
So underrated.
Yeah, we see it all the
So
time.
underrated.
Yeah.
It really does give indication of aging, just because, like we've talked about, that skeletization, when you're losing that volume, you don't have that round face that we all think of as a youthful appearance. So we do use it there. I think the main area most people know it for is that cheek area, nasolabial folds, which we'll kind of get into how to inject that area properly, and then as well as the lips, which we obviously have seen a lot of the past few years.
Other areas to treat, like the nose, the chin, the tear troughs or the under eye area. Also, Dr. Zane kind of already touched on the etched in lines, so using different fillers to kind of fill those static wrinkles that we're noticing, and it depends on the product that you're using.
I think the nose is underrated. I'm glad to see us doing more of those, what they call liquid nose jobs, where we're able to actually correct different, shapes of the nose essentially, and kind of create that more straight appearance, just to give that illusion of a more symmetrical nose.
Yeah, but we have to be careful about those. There is a high incidence of vascular occlusion or other complications in non-skilled hands. So it is a very risky area and should only be done, by your board-certified dermatologist or plastic surgeons who are very well-versed in the anatomy and injection technique, because, last thing you want to do is get a surgical rhinoplasty with filler and end up getting like necrosis or blindness.
And I'm losing your nose and eating a prostate.
Yeah. Not a good look.
Yeah. So who are good candidates? So that is kind of your classic volume loss patient, somebody who's likely aging. I mean, we're all aging, but aging is definitely a kind of predisposing factor for needing filler. Genetics plays a role. Lifestyle plays a huge role. That really depends on your metabolism. If you're a huge runner or anything, you're not as likely to have as much fat in your face. Those can definitely play a role. And I think too, also just, it doesn't have to be somebody who's in their, 50s or 60s. It can be anybody who doesn't like the look of part of their face or wherever. If you want your lips to be a little bit plumper, that's totally fine. It doesn't have to be from an aging standpoint.
I think the contouring is very important because, like Heather mentioned, certain insecurities people might have. For example, I've seen a lot of people have phenomenal changes. I had a friend that I had recommended her get some jawline filler and some chin filler before her wedding. And the difference was just amazing. I mean, it just gave structure to her face, and that little bit of the chin filler really helped to elongate and just give that proportional, value of things.
Yeah, it's amazing what a little filler can do. Even low volumes, you can change certain features that you have. And the fact that you can go and do a procedure like this within an hour and have a transformation is incredible. You don't have to go under the knife. You don't have to risk all those surgical complications you can get with plastic surgery. I mean, don't get me wrong. I mean, plastic surgery has its place, but it's not for everyone. Not everyone, is a good candidate. Not everyone wants to go through the downtime and recovery, and not everyone can afford it. So this almost kind of gives people more options to pursue some of these, areas of insecurities that they have and actually do something about them. And, patients, it's remarkable the confidence that you can restore in their faces. They just feel better about themselves. It's just incredible.
On the flip side, I do want to mention too that I think it's important, especially for the older subset of patients who might be looking for filler, that sometimes filler might not be enough for them, and that's sometimes a tough conversation. I've ran into that where people have gone to injectors and spent boatloads of money when they truly did need a facelift. And I think being able to have an honest injector who is looking out for your best interest is so important, because sometimes filler is not enough.
No, and sometimes not appropriate. It's not enough to actually anchor and suspend this tissue. You literally need to cut out tissue and resuture it and suspend it. Like, you need to go in there and make some structural changes. Otherwise, you're not going to get a result. And honestly, like, if you don't have the foundation for getting a good non-surgical result, it's just wasted money.
Yeah.
A lot of wasted money. So I do think honesty is really important, having realistic expectations, because, you could get a great result doing plastic surgery and have it last for like 10, 15 years, and the patient will be a lot happier than having, poor results or really minuscule results with the amount of money that they're spending. So I do think that, also partnering with a good facial plastic surgeon, I mean, I think that's really important to discuss all your options.
Yeah, I think there's a little bit of a flip side to that too, for especially the younger patients. There is definitely that art of subtlety. There are ways that you can use filler to not look overdone or even look like you had anything done. People just can get that sense of, oh, you look, rested or
Yeah,
refreshed.
that's what we're going for. We want you to look like you, but just more refreshed. I think a lot of people are scared of filler because they see in the media what bad work looks like. And, you see your Madonnas out there. I mean,
Joan
I love her music,
Rivers, yeah.
but I mean, she was such a beautiful woman. And I just really don't understand why she went the route that she did. And it's sad because she looks distorted. She looks like a caricature.
Yeah. And I think people would be surprised to know how much filler is truly in a syringe
That's a good
because,
question. Yeah.
I think people think, oh my gosh, even just one syringe filler, that's so much.
It's 1/5 of a teaspoon.
It's
One
a
cc.
chickpea, the size of a chickpea. So
Blueberry.
yeah, a
Blueberry,
blueberry. So when you think about that, it's gonna be more syringes than you might be initially thinking. So it's not crazy to say 2 syringes, 3 syringes. I had a training session years ago where I had 6 syringes in my face. I mean,
You got 6 in one setting?
yeah,
Wow.
I treated chin, jawline, lips, and then some cheeks. So, yeah, it was, at the time, just it couldn't tell, especially on the chin. I felt like my chin was really, recessed at the time. So, and then same with the jawline as well. So, you'd be surprised to know how much essentially filler really is.
But on the flip side, it's amazing what one syringe can do.
Yeah, done well.
Yes, done well,
Yeah.
strategically in the
Yeah.
right places. Like you can dump filler in the wrong places and just waste a lot of product. It's not going to do anything.
Yeah.
And that's where that expertise comes into play. Where can you inject to get the best bang for your buck and execute? That's really what I'm looking for because, this is expensive stuff. It's an investment. So I want to maximize result, and the best ROI is achieving those results with the least amount of product.
Yeah. So going into that, complications that can occur with filler, there's the adverse reactions or the side effects, I guess, most commonly we see is bruising, especially I think people who are on any aspirin or blood thinners.
But is that really a complication? We are
No.
injecting a patient with a needle.
I'll take bruising any day of the week
Yeah.
because it will
It's
go
just a
away.
side effect.
Yeah, I feel like
I don't even consider it a side effect. I think it is expected.
Okay,
we
that's
have
fair.
blood vessels in our skin. It is a part of our tissue.
we're jabbing it in
We're
there.
jabbing in there with something sharp. It's going to bleed. You're
Yeah.
going to get a bruise. So expect a bruise.
Yeah.
Although, we're gentle with our techniques and I try to minimize bruising, I don't think patients should be left to think that they're not going to bruise.
I think
Yeah.
that's fair because I think a lot of people put more emphasis on bruising
Yeah.
than needs to be as something that goes away in a few days. It's yeah.
And, like we always counsel our patients, take your arnica and bromelain. I do think it helps.
Ice.
Try to reduce taking any blood thinners before your procedures or after.
Alcohol intake after.
Yeah, I mean, there are ways to kind of reduce the risk of bruising, but bruising in itself is not a complication. I want to get that through.
Yeah.
Because patients are like,
Hot
oh my
take.
God. Yes.
Bruising's normal.
Yeah.
A little bit swelling again is also
Yeah.
normal. When you think about any kind of procedure to the skin, you're creating a little bit of that inflammation, and that's what's causing that swelling. So swelling is very normal.
But also, hyaluronic acid attracts water molecules.
That's
Right.
true
For
too.
every molecule of hyaluronic acid, it attracts 1,000 times the number of water
Yeah.
molecules around
Yeah,
it. So that's
you
part
get
of it.
that swelling, and that does dissipate in days.
Other kind of serious adverse reactions or even potential complications. Infection is always a risk. I think that depends a lot on technique.
Cleansing the skin.
Yeah, exactly. Allergic reaction, we don't know if you're allergic to it until we know that you're allergic to it. So, but, going back to the hyaluronic acid, we all have hyaluronic acid in our bodies. So that is safe in that standpoint.
Many hyaluronic acids are compounded with lidocaine. So I guess there is a rare instance where if you have a true lidocaine allergy, that's something to disclose to your injector prior to injection.
Yeah.
Yeah.
And vascular occlusion, which tends, correct me if I'm wrong, tends to be maybe a little bit more injector error or not aspirating.
Not really. I've heard of some of the best injectors in the world come across this complication. In fact, most people say that, if you haven't gotten a vascular occlusion, you're truly a busy injector. You haven't been injecting enough.
Okay.
Yeah.
It's likely going to happen at some point
some
in your
point.
career. And it's scary. It's humbling. Studies have shown that even with aspiration, that doesn't mean that, you haven't cannulated a vessel.
Yeah.
And it is scary. And I think that you just have to be very mindful and knowledgeable of the anatomy, knowing where the danger zones are. I had one patient at my practice in New Jersey, I'll never forget. She was a nurse practitioner. She went to another physician, not a dermatologist or plastic surgeon, I think just an internist who does aesthetics on the side. And they were injecting the glabellar lines with filler.
Very dangerous.
Very
Yes, very
dangerous.
Can be done with the right person, but
It's a risky spot.
It's a very risky spot.
The funny thing, it's not funny, but she started getting a lot of redness and swelling, like streaks, going up where those blood vessels were. And you could see the duskiness of her skin, and it was impending necrosis. And she went back to her injector, and the injector said, "Oh, this is an infection. I'll give you an antibiotic." She did not feel right. She's a medical professional herself, so she did not feel easy about that. She literally called offices around in the area. I've never seen her before. She called, "Hey, can you just take a look at this?" And I brought her in. I'm like, "Whoa, this is vascular occlusion." And we could see it's called a reticulated or net-like pattern. You can kind of see that happening when you block a blood vessel, and the oxygen supply, because the blood's not flowing there, is starting to be compromised. So what we did was we immediately flooded the area with hyaluronidase, specifically Hyaluronic, to help to kind of break up that hyaluronic acid and hopefully restore some of that blood flow to the area. And thankfully, it helped. And we did it serially over multiple sessions, and we were able to save her skin. She did have some discoloration in that area, which we used some vascular lasers to improve, and it really looked amazing afterwards. And she was so thankful, became a loyal patient of ours. And it just goes to show you, even like medical professionals, they may not be educated or knowledgeable, like, hey, you can get vascular compromise in that area. Same thing with nasal injections. That's another hot area for, vascular occlusion, or, kind of injecting around, the eyes and around the, angular artery. There are so many networks of blood vessels. And if you get into the wrong one, you can even get blindness. Like if it gets into, the wrong blood vessel, it's going to migrate and literally cause blindness. And there are multiple reports of that happening in the literature. So you have to be really careful.
Yeah. And I think going into that, if you're ever having questions after your filler appointment, be safe. Don't be sorry. Contact your provider because
we don't mind.
Yeah.
We're here to help you. We want you to be safe and healthy. So even if you think it's silly and you're just uneasy about it, just call us.
Yeah. Sometimes we get the calls with more of the lumps or bumps, which that can happen after the swelling.
Yeah.
So again, I think we would much rather you ask us than not. We don't know unless you tell us.
Exactly.
Something that most people don't really think about, just the filler has the ability to move. I think it depends on the depth of the injection too, but once it's placed in, it can still move with your skin as you age.
For those who have not had filler before, you definitely want to do a consult with a educated provider, someone who's been doing this, where they'll be able to give you an idea of what you want to achieve, and kind of speaking earlier to what your requests are and finding that provider that kind of works with you. Again, some people want the really big duck lips. That we say it all the time. That's not like Dr. Hussein's wheelhouse. So don't come to us for that. But
I know some good practices I can send you to.
Yeah. So finding a provider that is in line with your views as well. Once they are able to do that consultation, making sure that they're using sterile equipment. Typically will numb a patient depending on what areas we're treating with a topical lidocaine. So you always want to express any allergies that you may have specifically to lidocaine. At that point, typically we'll get the syringes ready and then clean you off with typically HIPAA cleanse is what I use. And at that point, you can expect a little bit of discomfort, but I think overall it's really well managed. I know we use different tools in our practice, like vibration devices to help distract, squeezy balls just to kind of hold on to, and then obviously ice as well. So I think overall it makes it a pretty easy experience. And then at that point, you'll go home, you'll ice, avoid alcohol, avoid exercise.
Kind of going off of that, laying on your side afterwards. Ideally, you don't want to sleep on your side, especially if you have filler in like your temples, your cheeks, your jawline, because if that filler is not quite, set in place yet, you could move it or push it somewhere else.
Yeah. And a lot of patients, especially if it's your first time, it feels a little tender. It feels sore. That is normal. You can take Tylenol if you need it. You can even take ibuprofen. It's fine. Your skin is getting used to having a product there that has not been there before, and it's kind of integrating into the tissue. So it's going to feel a little weird, especially like, your temples, like you haven't had volume there. It's going to swell a little bit. You may get a headache. It might be tender. On bony prominences, it can be pretty tender.
I felt that with my chin for sure.
Oh yeah,
that tightness.
It can be pretty painful, but it's manageable. And I think that, just with over-the-counter, pain relief, usually sufficient. Other things that patients are, sometimes concerned about, the bruising, like we talked about, but, arnica, bromelain, other anti-inflammatories can be helpful. We also have tools in our office to help reduce the bruising. So using vascular specific lasers or IPL can be very helpful for reducing the length of time you have that bruising. So we offer that complimentary to our patients if they have any, bruising. They can always walk in the next day and we can get that taken care of for them.
Make sure you feel comfortable during your consultation. If there's any type of feeling that you're not seeing eye to eye with your provider, maybe they're pushing you to do a little bit more than you're comfortable with, or maybe there's, I don't know, areas that you are not ready to treat yet, like lips or things like that. Always feel comfortable enough to say, maybe this isn't the practice for me. You want to feel comfortable and confident during your consults and have that translate into your treatment for sure.
Yeah. And if you're not comfortable with filler or the thought of filler, there are other alternatives.
Yeah.
So we've been using PRP, microneedling, and other devices to help. So, you can get subtle and nice improvements with that. It's not going to be as extreme. I'm just being realistic with patients, but you will see some improvement in your skin quality, texture, and you will probably notice a little bit of volumization over time, but it's not going to be as immediate. Like the immediate satisfaction and gratification of seeing those results right away is incredible with filler, but you can over time kind of get closer to that.
I always say filler is like the quick fix.
It is.
I really like the kind of during treatment, if you do one side,
A half face.
yeah, give them a mirror.
Yeah.
See what kind of changes they're already noticing. I think that's a huge, huge benefit to get the patient just realizing how filler can be used. And there's definitely, fillers for different areas. There's always if you are going down that route for filler, there is a type of filler for your specific need, and we can help you find that.
Yeah, and there's a filler for every skin type. And, there are patients that can benefit from it at, various ages, at different ethnicities, and just kind of maintaining whatever beauty ideals that you want to strive for, we can achieve that, but it's very customized.
Agreed.
Yeah, the consultation it should take a while. It shouldn't be this very quick process. I think, you do have to spend time getting to know your provider and, like Courtney said, seeing eye to eye and making sure that your desires fit what they're, expecting to give you.
The nice thing is about these hyaluronic acid fillers is if you don't like them for any reason, they can be dissolved. So that's the beauty of hyaluronidase, also known as Hylenex or Vitrace. We can break those cross-links with the hyaluronic acid molecules, and it just makes it more liquid and just reverses it instantaneously. So it's a nice option that we have, especially if you're scared about it, you can reverse it.
Good point.
Awesome.
Oh, that was
Alright.
pretty good.
Yeah, so I mean, fillers, have a lot of different opinions.
Yes.
People are very opinionated about them. Some people love them, some people hate them. But I think it's another tool that we have to help patients feel more confident. Done with the right training, with the right knowledge and education, I think patients can achieve a really nice natural aesthetic that they're looking for.
Agreed.
Yeah.
Yeah. All right. Well, this was a great discussion. Hopefully, you enjoyed this episode, and please like and subscribe. And until then, Skin Side
Out.
Thanks for listening. This episode of Skin Side Out is complete. If you enjoyed today's episode, don't forget to subscribe, rate, and leave a review wherever you listen to your podcasts. For more tips, updates, and behind-the-scenes content, be sure to see what fun we're up to on TikTok. Follow us on Instagram and Facebook at Nor Dermatology and Aesthetics. Check us out online at norderm.com. Discover why our patients give us 5 stars on Google. Call us today at 919-617-0717.